Dr. Pravin, you must be seeing a lot of psoriasis patients. So, what is their typical mindset and mind frame when they meet you first time?
So it's disturbed, obviously. I mean, patients are very conscious about, the smallest of the skin that is peeling out. They have a very low self-esteem that whether it is something related to leprosy, something related to cancer.
Personal life, especially the married life, and how it affects in psoriasis patients. Could you throw more light on it?
Getting a partner at the first becomes a problem. There is always an internal turmoil that whether he'll be accepted. So sometimes even psoriasis can involve the genitals. So he may have even inhibition, even cohabiting with his partner.
How important do you think lifestyle as a beginning to the management?
So most of our patients have been told to avoid alcohol and smoking strictly. So patients should not engage in very high calorific diet and engage into some sort of physical exercise, like either it may be in the form of a walk or swimming or something.
Painkillers are one of the biggest triggers for psoriasis.
I went to a doctor, I have psoriasis and I have joint pains. Do I have arthritis which is related to psoriasis? Hi friends, I am Dr. Rahul Savakhande, CEO and Director at Akar Medical Technologies Limited. Today is a very important day and a very interesting discussion that is going to happen. Yesterday was World Mental Health Day, and in this month on 29th October there is World Psoriasis Day. So obviously psoriasis has a big impact on the mental well-being of the patient who suffers from psoriasis, and there is a lot of social stigma. And we have with us two great dermatologists and with their great experience in management of psoriasis, with thousands of patients that they have treated in psoriasis, and they have managed their mental health well. We will understand from them more about the mental well-being, the disease pattern, the epidemiology, and how we can manage it better in future. So we have with us Dr. Pravin Banodkar and Dr. Shreyas Kamath.
Thank you, Rahul, for having us here. Hi friends, I am Dr. Pravin Banodkar. I am a consultant dermatologist practicing in Mumbai for over the last 17 years. I have my private clinic, it's called Skin Crest Clinic, located in Matunga, and also attached to a number of hospitals like Saifi Hospital, St. Elizabeth Hospital and Breach Candy Hospital. And I'm also a founder and director of an education company called Skin Beyond Borders. I'm so happy and very excited to be here to talk on a very relevant topic of the ever-increasing psoriasis patients that we are seeing in practice.
I'm Dr. Shreyas Kamath, practicing clinical dermatologist and dermatosurgeon in central Mumbai since 25 years. Also the founder and chief proprietor of Dr. Kamath Skin and Smile Care. And I'm attached to several city hospitals like Holy Family and Shushursha hospitals. And I also conduct researches on several projects involving skin cosmetics and newer formulations.
Thanks, sir. I again would want to bring you back to the topic of mental well-being. It is very difficult life when you have lot of scaling around your body and if it is visible. Attending a regular office, regular school, doing day-to-day daily activities would be an issue. So, Dr. Pravin, you must be seeing a lot of psoriasis patients. So, what is their typical mindset and mind frame when they meet you first time?
So it's disturbed, obviously. I mean, patients are very conscious about, the smallest of the skin that is peeling out. They have a very low self-esteem. They are very anxious as individuals. The reason is because psoriasis has always had a stigma. Earlier, as we were discussing earlier, around 40-50 years, there was this stigma of leprosy, stigma of something contagious and completely disturbing the life of patients. So patients have that fear that whether it is something related to leprosy, something related to cancer. So patients get very anxious about it. So overall, the mindset, if you see, is something that we focus on, during the treatment. So it is as important, and you rightly said, World Mental Health Day, and what a great time to have this discussion where we can speak on both the topics.
Dr. Shreyas, before the discussion started, we were talking about personal life, especially the married life, and how it affects in psoriasis patients. Could you throw more light on it?
Yeah, so psoriasis becomes a very complex issue to handle, even from the right partner getting a suitor. So if the psoriasis patches are there on the exposed area, especially on the face, scalp, or in the extremities, the person is naturally inhibited, especially in a social environment. If he is so getting a partner at the first becomes a problem. Once he gets married, there is always an internal turmoil that whether he'll be accepted in his family life by the partner of the opposite sex. So sometimes even psoriasis can involve the genitals. So he may have even inhibition, even cohabiting with his partner. Then once he cohabits, then when the lady is pregnant, she will also have even apprehensions about her child getting psoriasis, and there is a fair chance that somewhere between 5 to 15% in some families where psoriasis runs in generations. So the other thing is like also the other siblings of the family, sometimes they don't accept it. If there's a psoriatic child in the family, he's always kept aloof, he's always isolated. So a psoriasis child always has some sort of inhibition right from childhood. And we as doctors, it's our chance to counsel the parents as well as the child to get him out and to treat him right at stage 1 or stage 2, so that he loses those inhibitions and he moves around freely and he has a normal life.
It's not the single person who has psoriasis is affected, and it's the families that get affected and the social stigma carried with it. People try to isolate these people, and I think it's an important message that it is not a communicable disease. And we will understand more about why it happens. Like if I am having psoriasis today, why me? Why God chose me? Sir, if you could throw light on why me.
So why me? The answer is it's not that simple. It's because psoriasis is a chronic inflammatory disorder, which is a complex, interaction between the genes, the environment, and the immunological pathway. So you need all these three switches on to get psoriasis. Supposing if a person who has the psoriatic gene and if he has an abnormal immunological response, but he doesn't have the environmental stimulation, so then this psoriasis may not present even sometimes throughout life. Sometimes in the ripe old age, psoriasis age of presentation may be at 70 and 80. So this kind of gives a false opinion to his family members that, it is not genetically inherited. But what happens is the trigger, the environmental trigger is one of the most important. Now the environmental trigger may be in the form of, environmental pollution or some stress or some injury, or it may be, an internal mental trigger, like in the form of mental stress. So these are two kind of triggers. You have an external trigger as well as you have an internal trigger. The second thing is sometimes triggers may be in the form of drugs also. We take a lot of psychotic drugs like lithium is a known trigger. Beta blockers are a known trigger. Sometimes it may be in the form of food. So if the patient is having a very rich diet in the form of, having a lot of butter, ghee, or a lot of sweets, which increases triglyceride level, that also can be a precipitating factor for his psoriasis. If he has an unhealthy lifestyle, like he's into alcohol, smoking, or into drugs, that can also precipitate. But I have many of my patients, just as we are talking, that I had a patient who was diagnosed as psoriasis maybe around 20 years ago, which involved more than 30% of his body surface area. He just came to me today morning, and as a result of his only disciplined lifestyle, he was not having any systemic drugs. Although 30% body surface area warrants systemic treatment, just at the disciplined lifestyle and just taking care of his skin resulted in dramatic reduction of his psoriasis to less than 1% body surface area. So that's what disciplined lifestyle can give you. But very few of us can can manage modern mental stressors.
Understanding that pollution plays a very important role, and since we are staying in metro cities and tier 1, tier 2 towns, is there an increased propensity in patients staying in cities only having this versus the people staying in the village?
So overall prevalence, if you see, in India over the comparative, data over the last maybe, 40 years or so, the overall prevalence in India has increased to, approximately around 3% to around 4%, which is almost equivalent to the global data that was there, in comparison. So this overall increase has been largely due to a urban population, where we see more of psoriasis. But there could be many reasons to this. One is because of the amount of awareness that people have in the urban areas, because of they have access to facilities. Of course, now mobile and information is there all over. But in terms of access to healthcare, access to dermatologists who they can go and see the same day or the same week, and as a result of which the diagnosis is made earlier. So overall, if you see, the prevalence is influenced by that. So presently, yes, in urban areas, more cases are seen compared to the rural areas.
Dr. Pravin, when you see a psoriasis patient, and if you can classify that, what are the most common types of psoriasis that you see? Just for an example, like, is scalp psoriasis more common than any other psoriasis today?
Right. So this is a very important question, because determine on what we see, we can determine the treatments. So I'll just repeat that. So on the basis of what we see, we can actually determine the treatments that are followed. So patients, they tend to have palmar psoriasis, palmoplantar psoriasis, that affects the palms and soles. We also see something which is called a scalp psoriasis, which is restricted to the scalp areas. Then there are psoriasis which can affect the flexures of the body. Flexures means all the body folds get affected. Then you have genital psoriasis, which affects only the genital area. Then there's another type of psoriasis that we see, which is the nail psoriasis, where you have only the nails involved, and patients wonder why their nails are cracking, why they are red, why they are splitting up for no other reason, and they unfortunately don't know that it can be due to the psoriasis. And of course, then you have, apart from these localized areas, you also have the chronic plaque psoriasis. That is the most common form of psoriasis that we see. So psoriasis can present, as you said, less than 1% body surface area, less than 5% to more than 10%, to the very severe forms to more than 30% body surface area. So when you have the severe forms of psoriasis, which is the chronic plaque psoriasis, also called as psoriasis vulgaris, this presents very commonly on the extensor parts. Extensor means the front of the elbow, the front of the knee area. And, you have your foot, ankle basically involvement. And it's associated with the red, erythematous, what we call as red, thick, scaly plaques. So these are the common, presentations which we see in each of these areas that I mentioned.
Thanks, Doctor. Dr. Shreyas, in your practice, do you see very commonly patients with psoriasis getting hair loss? Because there is a lot of discussion happening that it could be one of the reasons for hair loss.
So it's a very good question. So most of the earliest presentation of psoriasis may begin on the scalp. Most of the patients or the peers or the parents mistaken it as dandruff, and the patient presents very early. So at that time, it may cause a hair loss, possibly due to anxiety or due to chronic scratching. So there is no involvement of the hair root or the follicle as such. And if treatment is instituted very early in this case, this kind of temporary or periodic hair fall can be avoided. Sometimes patients have very long-standing cases of psoriatic plaques. So there is long-standing inflammation of the hair follicles. So sometimes it may produce a kind of diffuse hair loss on the patches. And the other problem also what we recognize is many of the patients who have hair loss like androgenetic alopecia, or which is known as commonly baldness. So they are more afraid that, if they have an underlying psoriatic plaque, it might get manifested or it might become visible. So that's the reason why most of the patients of scalp psoriasis are very serious about their treatment. Because, they are scared that, the underlying androgenetic alopecia, which has been masked by the hair, will slowly come off. The cover comes off.
Thanks, Dr. Pravin. Thanks, Dr. Shreyas. Again, it is very important that when I know that I have psoriasis, and the most common question is, I have to live with this for life. Now, typically, anybody would straight away jump to conclusion that, okay, this could not be treated, or this could be managed. So treatment and management is a very important part of dealing with psoriasis patients. Other than the psychological problems, we need to treat them with the visible signs and symptoms. How important do you think lifestyle as a beginning to the management? Dr. Shreyas, we can start.
Yeah, so I give you an excerpt of my patients. A disciplined lifestyle is very important. So as soon as the patient comes in the first consultation, we take a detailed history regarding his, his habits, even his habits in the past. So like whether he is, he's into tobacco addiction or whether he's into alcohol addiction. So sometimes a question which is most probably put for our patients is, can I indulge in alcohol occasionally? So what medical research says now that even half, a peg of alcohol is also equally has a deleterious effect, although it may be temporary. So most of our patients have been told to avoid alcohol and smoking strictly. That's one thing. The second thing is the disciplined lifestyle that include a very disciplined diet. So patients should not engage in very high calorific diet and try and concentrate eating more natural foods in the form of, fresh green leafy vegetables, nuts and fish. Fish is supposed to be very healthy for psoriasis. The third thing is he has to avoid red meat. As far as possible, prefer lean meats like chicken, and preferably grilled rather than fried. And the other part of lifestyle is in mental relaxation and getting enough sleep. Patients are advised to get continuous sleep at night for at least 8 hours and engaged into some sort of physical exercise, like either it may be in the form of a walk or swimming or something, and also some form of mental relaxation in the form of any form of yoga which can relieve his stress.
Another very important point in lifestyle is the habit that we see nowadays of people popping pills, taking multivitamins, painkillers. They just randomly buy it from any pharmacy store. Painkillers are one of the biggest triggers for psoriasis. The protein powders that you take for gymming, for a lifestyle, that itself can trigger, psoriasis to a very great extent. So I think, and the most important, as nowadays we are fighting obesity and weight gain, the biggest inflammatory pots in the body can keep triggering psoriasis. So I think these are the points that I would like to add.
Would not have fair bit of idea that what all therapies are available. And it is important, I think, in today's discussion that we throw some light. I know it will be more technical, but I think it is important for the patients to know that what kind of therapies are available and what are the choices that they make, because otherwise they might indulge in self medication because a lot of misinformation or excess information that is available. So if you could throw some light on what are the treatment modalities available, like we mentioned small molecules. Now, for a patient, I know it is difficult to understand, but with the availment of so much of data on Google and now the AI, Chat GPT and Gemini and whatever, they will get all this information still. But if you throw some light on what are the different classes of therapies available.
So I think before going into that, one very important message to send across to people is that, psoriasis is not just a local skin disease. It is basically a systemic inflammatory disease. What I mean by systemic inflammatory disease is that patients who have psoriasis have so much of inflammation in the body that they have inflammation of other organ systems. You can get psoriatic arthritis. It puts you, in fact, at a more risk of cardiovascular morbidities. That means cardiovascular risk. Chances of ischemic heart diseases are more in psoriasis patients. Then you have psoriatic patients who are at more prone for other metabolic diseases, like your abnormal lipid profiles, your diabetic situations which can come up in the life of a patient of psoriasis. So when it comes to therapy or treatment, most importantly is to meet a dermatologist, like what you rightly said, important to classify. So if you have if you want to classify psoriatic treatments, they can be divided into topical treatments, which are applications which include ranging from moisturizers to steroid creams, which are prescribed by the dermatologist and strictly the dermatologist. Then you have a newer age anti-inflammatory creams which are called as topical calcineurin inhibitors like tacrolimus, pimecrolimus, You have the new JAK inhibitors, which are available as an ointment formats. And role of moisturizers should not be underestimated. They help to maintain the barrier of the skin, which is very much disturbed in psoriasis patients. And when it comes to oral treatments or systemic treatments, then as Dr. Shreyas just mentioned, we can put them as conventional treatments, or the older treatments, the newer treatments like biologics. And the older treatments include the immune suppressive medications, which can actually suppress the entire immunity in the body, which have been the long run armamentarium we've been had, like methotrexate, cyclosporine, azathioprine, and a lot more, which we will discuss ahead. And biologics are the new target therapies, which you can use them to target exact areas from where the inflammation of psoriasis is beginning. And of course, we have newer complementary, supplementary treatments that are coming, which can play a big role in reducing the psoriasis flares.
What are the common side effects that you see to these kind of therapies that are available? And if you are particularly cautious with certain medications?
So, as we know that all medicines have side effects, and it includes all disciplines of medicines, whether it is Ayurveda, allopathy, or any other allied branch. So the chief responsibility of the doctor is to monitor the side effects. Of course, he monitors the effect of the therapy, but he's there more importantly to monitor the side effects. So one thing is that all the topical therapies, chiefly being topical steroids, we know that topical steroids over a period of months and years can be systemically absorbed in the body, and they can cause systemic side effects. Topically, it may cause thinning of the skin, and they can cause localized infections. And sometimes we have a new entity which is called as a hidden ringworm infection. So you have a hidden ringworm infection festering always, sometimes in psoriatic plaques, especially on the legs. So then even we don't give systemic steroids in psoriasis. Systemic cytotoxic agents can cause deleterious effects, chiefly among them being liver toxicity. It can cause bone marrow toxicity, and it can even cause sometimes even perforations of the gastrointestine, like chiefly among being methotrexate. Sometimes it can cause even renal toxicity. So, other agents like the popular agents like cyclosporine can cause hypertension if given after 6 to 7, 8 months. Then you have acitretin, which can also cause liver toxicity. And then biologicals, although the side effect profile of biologicals is lower, but we always have to watch for infections. Then coming to the newer, smaller molecules, like what we have is the tofacitinib and the other newer molecules. We have to constantly monitor them for side effects like minor infections, viral infections like herpes, or boils, what we commonly call as pyoderma. They may also cause your vaccination to even fail sometimes, and they also can cause end organ side effects, so chiefly being liver failure, and sometimes it may cause even renal failure also.
Again, very important point. And with these kind of systemic side effects and side effects because of any kind of medication, I commonly have been since childhood hearing, ये तो नेचुरल है, इसका साइड इफेक्ट नहीं होता, बट ज़्यादा खाने से भी साइड इफेक्ट होता है. तो you should always be understanding this fact. Side effect is anything that is in excess. Whether you are drinking excess water or eating excess food, it will cause side effects. So be careful. There might be tall claims that there is no side effect. So always understand that whatever you are consuming and whatever goes to your body, like an excess sugar, excess fat, or excess protein, will affect your body. So medicine, obviously. When you are managing yourself and your doctor has prescribed you certain medications, you feel that the consultation is too expensive and you don't go back to your consultant, you are doing a wrong thing, because what will you lose in long term is a lot of money and your health and the number of years that you will live. So go back to your doctor, visit the consultant frequently, and keep managing your disease with them, as they are the partners in managing your disease for long term. Hi friends, like we were discussing about biologic, there is an interesting case that Dr. Shreyas was just discussing before we had a break. So yes, doctor.
So there was one patient of mine who was recommended biologicals for his severe condition of his psoriasis, and he went up home and he googled up the side effects of biologicals, and he frantically rang me up at night saying that, doctor, I will not take up this injection as a part of my treatment, because most of the sites say that in less than 1% of the treatment population it has resulted in flare of the existing disease. So I replied to him very casually, like, if the incidence is less than 1%, there is also a fair chance, which if you regard as less than 1%, that you might be an Ambani one day.
It is very interesting point to be noted. Most of the patients today Google up, and now with the advent of Gemini AI assisted Google, you might end up saying, okay, I have this disease and I have that disease. I remember my MBBS days, and when we started learning medicine and pharmacology and pathology, every disease was my disease. So please remember, you don't have to Google up. We have qualified people with so much of experience out there. Talk to them. Obviously, you need to be informed what is happening with you, and taking informed decision is a good decision, but don't get worried about it. There are people who are managing you with great integrity and ethics, so trust them.
I would like to, I just remembered one thing, similar incidents like this, as you said about ChatGPT. I had a patient the other day, and after thorough consultation and going through the entire journey of what the patient had, and I had written some medicines for the patient of psoriasis. After the consultation was done, the patient just said, "Doc, 1 minute." So I was wondering what happened. Immediately she typed something, on the phone, and in fact she was using ChatGPT, and she was just confirming whether what I had written was, actually going to work for her or not. And then when I wrote that, it came up to, a list of certain side effects. So it was like a similar scenario which Dr. Shreyas just mentioned. It just reminded me of that.
and I think we need to be very cautious. And yes, one more thing that has changed, and for doctors very recently, I think there is a High Court or a Supreme Court judgment that doctors need to write legibly or give printed prescriptions. So now people are very cautious. So things are changing very fast, and what was a legacy of writing a certain style of doctor writing, I think we are going to shift soon to the printed prescriptions only. Nice discussion. We are here also to discuss about one of a pride moment for me especially. So I was working in Piramal Healthcare in year 2010 when we were working on a product which is a phytoactive derived from Spiranthes indicus, and this extract was used to manage psoriasis, and we did a lot of clinical evaluation, both the phase 2 and the phase 4 study, and the study was done in more than 500 patients, and we studied the product for its efficacy. And there were a lot of dermatologists involved, and there are 20 plus more centers involved doing this clinical study, and based on the study and the results, we got clinical approval. The brand name was Tinefcon, and we have Dr. Shreyas and Dr. Pravin here who have also clinical experience of using this product. So we will throw more light on Tinefcon. More importantly, why I am proud is, from India there is not too much of research coming out. Recently Wockhardt got its antibiotic approval in US for managing ICU related infection and drug resistant infections in ICUs. And again, it's a proud moment because after 30 years, a first new antibiotic was approved in the world, especially the US FDA, and it came from India and from Wockhardt, so it's a proud moment. Similarly, Tinefcon is a research from India, already marketed in 20 countries. Luckily, unluckily, it only got launched this year in India, and we have 2 experts who have used it clinically also now. So let's hear from them. Dr. Shreyas, phytoactive, and there is a lot of apprehension, especially amongst the patient and the doctors, that when we say phytoactive, will this work, or is just run of the mill product? So what's your opinion about Tinefcon?
So basically, herbal drugs and herbal supplements have been used for a very long time to treat various skin diseases, and I've been using a lot of herbal preparations, chiefly Sorello corypheria. Then there is chin dye, that is indigo blue dye. Then there is curcumin. This is to speak of a very few. There is a whole list of allied herbal medicines. So actually, I was encouraged to use this product because this has gone through all the phases of drug study and surveillance. That is, all the phases like what your actual allopathic drug undergoes. That is phase 1, phase 2, phase 3, and phase 4. That is the marketing surveillance to see whether there are any side effects after it has been launched. So that chiefly got me into use this product. So when I started using this product around 4 years ago, it did not achieve much of marketing because it was launched by another pharmaceutical company, but the marketing was very poor. So the penetration into the market was, very sparse. Availability was also very sparse. And it was a time of COVID. So this use was very restricted. And that time the psoriasis were aggravated possibly because of COVID co-infection. There were many patients who were undergoing therapy in COVID and who could not use cytotoxic drugs or biologicals because they used to cause immunosuppression. So that time Tinefcon was a viable option in most of these patients. So many of these patients were put on the recommended dose is 2 capsules morning and evening, but many of my patients did very well even on 2 or 3 capsules a day, and they were taken for extended periods of time, that up to 3 and 4 months, 5 months, 6 months, and the efficacy was well maintained. Most of these patients were discouraged, as I told you, from using other drugs because there were many interactions, because patients were taking multiple drugs at that time. Something for COVID, something for hypertension, something for diabetes. So in this scenario, most of these patients did very well. And that time, the topical form of Tinefcon was not available. So patients were only using these capsules and they were using topical moisturizers. Now this has been formally launched by Akar, so it is made things more convenient for the patients and also for the physicians. More studies has also been done, more information has been divulged to the patient regarding the product, and the product even can be purchased online. Although it could be purchased online internationally, now even Akar has also made it also available online. And right from the time I started it, any of the patients, although the patients had been investigated fully, thoroughly, none of these patients developed any end organ toxicity like increase in transaminases or derangement of any enzymes. And even after 3 years, they have not come up with any malignancies or aggravation of latent tuberculosis. So, and patients have been adherent to the treatment. So they have not stopped the treatment, and there has been no loss of efficacy in the last 3 or 4 years, which are unlike biologicals and small molecules may undergo.
Thanks a lot, Dr. Shreyas. I think we are taking a great confidence from your experience, and for us it's less than 6 months that we have launched the product. Dr. Pravin, you also have started using it in your practice. How was your experience, sir?
So this molecule, which is a phytoceutical, with a medical license and so much of research, as Dr. Shreyas mentioned, is a very good drug. To place it as a great, immunomodulator, you can call it. It has a role, in kind of reducing the inflammatory cells, which we call as TNF, alpha, the chemicals that trigger psoriasis, and keep psoriasis going on as a journey. So overall, it helps in regulating those molecules, keeps them under control, and brings basically the overall psoriasis, in under control. So, the doses which we start with, as, a 2-tablet course in the morning and 2-tablet course in the night after food. In my practice, I have seen a good kind of control, of the psoriasis patients. I use it many a times, in fact, as a maintenance therapy also. What I mean by maintenance is initially maybe 3 to 4 months, I get patients under a control with biologic, and then later on I might use it as an add-on therapy to in fact regulate the immune system. So patient may not get enough. So the patient will not get the flares. The number of flares that I have seen is reducing. I'm able to get a better control over the disease. Secondly, topical applications is great for individuals like with high impact areas like one we mentioned, for the palms, the soles, the genital areas. You have, I think, a good range of the scalp cleansers, the skin cleansers as well. So in fact, I have put a number of patients on the scalp cleansers and skin cleansers, and they also do have that daily, washout, anti-inflammatory effect onto the skin, without causing too much of irritation on the, body. So it is something that the patient also is, happy about, utilizing some kit of products, all targeting the psoriasis, and it complements, the systemic therapies very well. When it comes to side effect profile, I've not seen any major side effect. I've been screening the patients like what I mentioned earlier for conventional medicines, baseline 1 month, 3 month test to rule out latent tuberculosis, hepatitis B. Same thing I'm following even for Same thing I'm following even for Tinefcon, because overall it works well as an immune modulator. But to be on a safer side, it's important to monitor the patients. A few amount of side effects that I may have seen are a little bit of maybe nausea, a little bit of loose stools, which I see with any other medication, whether it is a simple tablet of crocin to even certain multivitamin or health supplements which people take at the gym.
Something like metformin, which is very common for
exactly
diabetes.
That also, yes. So something like that, in fact, that could be something that can be managed through intake of probiotics, and it is self-resolving. It settles over a period of time.
So I'd like to also add one point. There was one patient of mine whom I discouraged from using cytotoxic agent, like methotrexate, and this patient had a borderline, level of increased transaminases, 10%, and surprisingly, this patient did very well on Tinefcon, and in fact, Tinefcon is supposed to have a hepatoprotective effect, so his liver enzymes came down over a period of 3 to 4 months. So it highlights the anti-metabolic properties and the antioxidant properties of this molecule also.
So thanks, doctor. Like both the doctors mentioned, when you are managing psoriasis in clinical practice, immunosuppression and hepatotoxicity are two key considerations, and obviously there is certain amount of benefit with Tinefcon in management of psoriasis while you are having these concerns. Tinefcon is known to be a hepatoprotective active, and also it doesn't suppress your immunity, but it down regulates. So your immunity is not completely out. It is there and helping you fight against the infections that could be caused due to immunosuppression. One important point that I have been encountered with during my discussions with doctors across India, that it's an herbal product. I need to tell you that yes, it's from a herb, but to classify it as a classical herbal product, it's wrong, because in ICUs we use products like digitoxin or digoxin. It's a product derived from plant. You are using artemeters and artesunettes to manage malaria. It's from plant. So please feel free to use the product, and it's an Indian research, and I think it will surely help doctors in their practice. We will have a small round of the famous quick fire questions, and we will have the red flag and the green flag. If I was Shah Rukh Khan and I love smoking and I have psoriasis, what should I do?
It's a red for me.
Of course, red.
Clear no.
So, no smoking, sir. Even if you have psoriasis or no psoriasis. If I love alcohol and I need to party and I have psoriasis.
Again, strong red.
I went to a doctor, I have psoriasis and I have joint pains. Do I have arthritis which is related to psoriasis?
Yes, I agree. We need to screen that.
I am a psoriasis patient and I love using self-medication. I heard somebody started using steroid cream. Should I use it?
No, self-medication is a wrong road.
I am a psoriasis patient. I have a very busy life. I am weighing over 100 kgs. Do I need to consult a doctor?
Yes, of course.
Do I need to reduce weight?
Yes.
I don't frequently visit doctor. I have psoriasis. Doctor gave me medication once and I am on oral methotrexate. I am not visiting the doctor. Is it a red flag?
It's a red flag.
It's the worst thing to do.
I am a psoriatic patient. Can I have diabetes?
Yes,
Yes.
of course.
So here we are concluding a hot topic with a cold coffee, the session of the great Indian dermatologist with two great dermatologists from India with great experience in managing psoriasis. This World Psoriasis Day, do surely have a look at our podcast and understand more about psoriasis and manage your disease well only by consulting a qualified dermatologist. Thanks a lot.